Presenter with us today. Debra Wells has been healthcare facilitator for UCSD for quite a number of years. She is a very strong partner of the UCSD Retirement Association. She sits on the RA board and makes sure she keeps all retirees well informed of everything coming up. So let's all welcome now Debra Wells.
Thank you, Suzanne. Is it okay to share my screen now?
Yep, you are set as a co-host.
Okay. Got it. So you can see Medicare?
Yes.
Okay, great.
You're good to go.
Well, thank you for allowing me to present today on Medicare and our UC-sponsored medical plans. Today, we're going to go over just a little bit about the Medicare basics because I believe everyone has already seen the presentation on Medicare, what UC requires of you, and we're going to go over the premiums, how it coordinates with UC-sponsored medical plans, and I'm going to give you some tools and resources at the end. So just a little bit about Medicare. There are many parts of Medicare. You have Medicare Part A, Part B, C, and D. So your Medicare Part A is your hospital coverage, covers things like inpatient, home health, skilled nursing, and hospice care. Your Medicare Part B is your outpatient services, doctor visits, ambulance, physical therapy, durable medical equipment. And then I'm going to skip over to Part D, that's your prescription drug coverage. And then Medicare Part C, also known as your Advantage plans, it has Parts A, B, and D combined into one plan. When it comes to UC, if you're eligible for our UC-sponsored medical plans, we have 5 Medicare plans that are offered through the university. So you have Kaiser Senior Advantage, it's an HMO. It has all parts of Medicare. We have UC Medicare Choice. It's an Advantage PPO. It has all parts. High Option, UC Medicare PPO. Those are 2 PPO plans, and they all have the Medicare parts that you need. And then the only plan, UC Medicare PPO without drug coverage, that's the only plan that UC offers that doesn't include prescription drug coverage. So a little bit more about Medicare Part D when it coordinates with UC's plan is it includes everything that you would need in a prescription drug plan, what Medicare requires of us. Now, if you have the UC-sponsored plan, just know that our plan is considered credible coverage. If you have heard that term before, we include what is required by Medicare. The formulary sometimes, if you're going from a non-Medicare plan to a Medicare plan, sometimes the drug formulary can change. I haven't seen it change much where there's a disruption in your prescription drug coverage, but just know that it can change. When you enroll in UC's medical plans, Medicare plans, that includes a prescription drug plan, you cannot enroll in another Part D plan. If you do, it will kick you out of UC's plan. And also when you're aging into Medicare, just know that it's there's a form that you must complete, and I'm going to go over all of this later on in the presentation. When it comes to Medicare premiums, this year in 2021, I've listed here what the Medicare premiums are. Most of you have worked and you have earned Medicare Part A for free. So you pay nothing for Part A. There are options if you didn't earn Part A to pay for it. Most of you wouldn't need to do that, but there is an option to pay. When it comes to Medicare Part B as in boy, everybody has to pay a premium for Part B, and it's based on your income. And they always look 2 years back. So in this year, in 2021, they're looking for your income in 2019. And then when it comes to Medicare Part D, most will not have a premium. But if you do have a higher income, you may have a Part D premium to pay. So what you do, whether you're filing individual or a joint tax return, you follow it along to your right, and there you will find what you will pay for Part B and or Part D. How are Medicare premiums paid? A question that I get a lot is UC going to pay for my Medicare? Or am I going to get reimbursed for what I'm paying for Medicare? And I'm going to go over how premiums work later on. But if you're currently collecting Social Security income, your premiums for Medicare will come out of your Social Security check. If you are not collecting Social Security income, you need to take action, contact Social Security, and make payment arrangements on how you're going to pay for your Medicare Part B and Part D. And I've given you some information here on how to set up payment arrangements online, or you can call Social Security and set up payment arrangements over the phone. Now, if you're not eligible for Medicare, you need to request a denial letter to show proof to UC that you're not eligible. What UC requires of you when it comes to Medicare. Now, if you're attending today and you're still working and you're not planning on retiring, enrollment into Medicare is optional. Most may enroll in Part A and they'll delay Part B because they don't want to pay for that premium when their UC plan already covers those benefits. So you have the option to delay. But if you're retired, UC relies on Medicare to offset the cost of insurance. A retiree over the age of 65 that doesn't qualify for Medicare costs the university twice as much to insure. Medicare partially reduces the cost, which keeps UC premiums affordable, which allows UC to continue to fund health benefits for retirees. Now, there's a Medicare fact sheet you can find online at UCNet that will go over everything that I'm covering today. If you're retired, if you, the retiree, or a family member becomes eligible for Medicare, it's no longer optional whether or not you're going to enroll in Medicare or not. You must enroll in Medicare Part B. Failure to comply may result in penalties or permanent loss of your UC-sponsored medical plan. There are some exceptions, and it's only for those who were retired prior to July 1, 1991, or if you're living abroad. But just keep in mind that if you're living abroad and you choose to cancel or delay your enrollment into Medicare, if you ever return to the United States and change your address on file with the university, they're going to require you to enroll at that time. And at that time that you contact Medicare, you could be penalized. So just keep that in mind. UC's Medicare prescription drug form. I like to I want to go over the different Medicare forms and when you need to complete them. This is a mandatory process and it is not automatic. You must take action, you or your family member that's aging into Medicare. So what you want to do is whatever plan you have on the left will determine which Medicare form you will need to complete. After you complete this form and you upload it to UC Raise or you fax it or mail it to RASC, then you'll be enrolled in the Medicare plan listed on the right. There's only one form that you'll see that I didn't list here, and that's for the UC Health Savings Plan. So if you're enrolled in this plan, the reason there's no form listed is because you have the option to choose any of these plans. After you choose the plan for you and your family, then you'll complete the form. Also, I want to point out that each Medicare eligible family member must complete and sign their own form. So when it comes to Medicare, you can expect a packet from RASC 90 days, 3 months before your 65th birthday. But if you don't receive that packet, it's still your responsibility to make sure that you start the Medicare process 3 months before your 65th birthday month. So here in this example, I'm showing someone that's aging 65 in the month of April. So 90 days prior in January, they're going to receive their packet with instructions on contacting Social Security, enrolling in Medicare, receiving your Medicare card, and making sure that you complete that prescription drug form that I just went over. Once you do that entire process, you want to mail that form in. In this example, if this retiree does not have their form in the month that they age 65, they're going to start being penalized every single month, $419.60 until you, the retiree, or your family member returns that form. Again, if you're not eligible, or if your family member is not eligible, you want to make sure that you submit the documentation to UC. Excuse me 1 second. Yeah. Not eligible for Medicare. Again, if you're not eligible for Medicare, if you did not pay into Social Security, nor you have earned 40 credits elsewhere, you could be eligible for Medicare through another family member. So you want to make sure that when you apply, if you didn't pay into Social Security, that you still apply because you could qualify under your current spouse if you're still married. But your current spouse has to be at least age 62. Now, if you're currently single, but you were previously married at least 10 years, and yet that former spouse is at least age 62, you could qualify under a former spouse. It's very important that you know the facts about Medicare and what UC requires of you. And again, you can find it in this Medicare fact sheet available online. A little bit about retiree health premiums. So when you retired from UC, you worked a certain amount of years. UCRP service credit is what we will look at in whole years, not your employment service credit, UCRP service credit. It also depends on your coverage level. If you're going to be covering yourself only, it's covering an adult or family coverage, the medical plan that you're in, whether or not you're eligible for Medicare. The premiums can be found here at this link. Here's an example of this year's 2021 medical plan premiums. I'm using the example of someone that is enrolled in UC Care and aging into UC Medicare PPO, and they have worked at least 20 or more years of service. So they have earned 100% of the UC contribution. Now, 100% of the UC contribution does not mean 100% of the premium. So I like to clarify this. There's a premium that's attached to each medical plan. UC is charged this premium based on your family members that you have enrolled. So in this example, I'm using UA, which is a retiree plus adult that's not in Medicare. The university is charged $2,330.98. Well, the maximum UC contribution for this family of two is $1,630.60. So UC, because they work 20 years, will pay the full $1,630.60, which leaves a balance of $700.38. So this family of two will have to pay $700.38 out of their retirement pension check each month. Now, if this family of two is aging into Medicare, which is the MM you see here, Medicare eligible retiree and their Medicare eligible adult. Now this plan only costs the university $913.40. The maximum UC contribution, $632.54, leaving a balance of $280.86 that the retiree would have deducted from their monthly pension. Keep in mind that even though you're paying this $280.86, you're also paying your Medicare Part B and or Part D premium out of your Social Security check. And this, I just have a side-by-side comparison of someone that didn't work the 20 years, but only worked 10 years. So because they only worked 10 years, they only earned 50% of the UC contribution. So a family of two in Medicare, same charge of $913.40. UC is only paying 50% of the UC contribution, leaving now a balance of $597.13. Again, that link that I shared in the previous slide is where you can find all the premiums every year for UC's plans. Now, how UC coordinates Medicare and your UC-sponsored medical plan. It's all dependent upon where you live. So if you're still living in the state of California and you're retired, all the plans listed on the far left is the plans that you have available to you. So the plans that are listed in black ink are your non-Medicare plans. The plans that are listed in red ink are your Medicare plans. If you have a split family, meaning some of you are eligible for Medicare and other family members are not eligible for Medicare, then you will have a family member stay in UC Care while the Medicare family member is in UC Medicare PPO. So you have these plans that are administered by Anthem Blue Cross. You have HealthNet that administers our UC Blue and Gold. Kaiser administers our two Kaiser plans, the non-Medicare and the Senior Advantage. And our United Healthcare administers our UC Medicare Choice PPO plan. Our United Healthcare plan are for those that are in the Blue and Gold plan, age into Medicare. This is your Medicare equivalent plan. Now, if you're living out of state and you're aging into Medicare, you will have the PPO plans. You'll see that the HMO plans go away. Our HMO plans are only in the state of California, along with United Healthcare, UC Medicare Choice. These are only available to retirees living in the state of California. So you would choose one of our PPO plans. Now, once your entire family is eligible for Medicare and you're living out of state, you'll then go through VIA benefits to select your supplement plan and your prescription drug plan. And I'll go over that more later. Now, if you're living abroad, remember I said that the university allows you to delay your enrollment or cancel your enrollment because they know Medicare does not cover anything abroad. So UC won't require that you enroll in Medicare. Just keep in mind, if you return, you may have a penalty. So living abroad, if you're retired and you're living abroad, you have two plans to choose from. There's no Medicare plans listed because Medicare doesn't cover any services. So you have UC Care or Core to choose from. Now, Medicare and HMOs. When it comes to our HMO plans or our Advantage plans, there's a form that you will complete and you'll be assigning your Medicare to your plan. Your assignment form, like I said, will go to RASC and you'll be switched over to your new Medicare plan. There's a Medicare premium that's paid, a flat monthly premium paid to your plan that will combine, and now they're responsible to cover your medical services. Once you assign your Medicare to your insurance plan, you can no longer use Medicare separate from your plan, okay? They're assigning, they're joining, they're marrying to each other, and they cannot be used separate from one another. So the Medicare split family that I mentioned before, if you're, you have some family members that are in blue and gold, and some Medicare family members in the Medicare Choice Plan, you'll just be in what UC calls a split or mixed family. Same with Kaiser. You may have some in Kaiser and some in Kaiser Senior Advantage. These are two Medicare Advantage and Medicare Advantage plans. So first I'll go over Medicare and how it coordinates with Kaiser. So I won't go over in detail Kaiser, because if you're in this plan, you already know how this plan works. But if you're aging into Medicare and you're currently in Kaiser, you'll see that there's some services that will change. And I've listed those changes in red. So you'll see inpatient will stay the same, $250, but your ER copay goes down from $125 to $65. Your prescription drug coverage stays the same. Now, under the vision benefit, as far as eyeglasses, where it was once not a covered benefit, Kaiser Senior Advantage members has a $150 eyeglass allowance. And this could be used with every 24 months with your frames and your lens. Now, keep in mind, Kaiser Senior Advantage is the only Medicare plan that the university offers that has a vision benefit built into the plan. So sometimes Kaiser members, they may opt out of VSP because they already have this vision plan. And then I have some retirees that will keep both vision benefits, because where this one, you have the benefit every other year, then your VSP would work on the alternating years. Your behavioral health benefit, I like to point out that as a Kaiser member, you have two behavioral health benefits, Kaiser and Optum. But once you age into Medicare, Optum goes away, but you still have Kaiser as your behavioral health provider. Hearing aids, you have an increase. Your hearing aid allowance goes to $2,500 per year. Kaiser Senior Advantage has the best hearing aid benefit out of the Medicare plans. Acupuncture and chiropractic services, you still have those benefits, but it goes up by $5. And your out-of-pocket maximum for the year is where it was once $1,500 for medical, behavioral health, and prescription. When you age into Medicare, it's $1,500 for medical only and in your behavioral health, but your prescription has a separate out-of-pocket maximum. You will still have access to Target clinics, and a new benefit in 2021 is Kaiser Senior Advantage is now available in the Fallbrook area and Kern County area. So when it comes to Kaiser and UC Blue and Gold, so if you're in the Blue and Gold plan, you know, 2 years ago, Health Net Seniority Plus went away. What replaced Health Net Seniority Plus is UC Medicare Choice. So family members, you or your family member that's aging into Medicare will then switch over to UC Medicare Choice. Again, it's administered by United Healthcare. Some of the same copay changes, your ER copay goes down, prescription coverage is the same, office visits are the same, your hearing aid allowance, instead of 50% up to $2,000, you get the first $2,000 applied towards your hearing aid benefit. So for example, if a hearing aid costs $1,000, UC Blue and Gold is going to pay 50% of that $1,000, which is $500. But if that same $1,000 hearing aid was to be received while you're under the Medicare Choice Plan, they're going to pay the first $2,000. So they pay that full $1,000 hearing aid. Acupuncture, you still have acupuncture and chiropractic services where this is a combined 24 visit under Blue and Gold. You get 24 visits each under the Choice Plan. You still have telehealth services, just a different vendor. Under the Blue and Gold plan, it's a HMO, so you're selecting a primary care physician. You have to stay within that medical group. You have to get authorization to go outside of the medical group. But under the UC Medicare Choice, you have open access. So you can go wherever you want. You just want to make sure that the provider accepts Medicare. So you would be able to use UCSD medical group today, Sharp tomorrow, Scripps the next day, so you have open access. Your annual out-of-pocket maximum is listed here. And these are some other options as far as medical benefits and services outside of your group. Now, when it comes to Medicare and your PPO plans, you're not assigning your Medicare to your plan like you did with an HMO. They actually do work separate from one another. So your Medicare plan is primary. Your Anthem Blue Cross plan will be secondary. Remember, you must use certified Medicare providers. The best way to find out if your provider accepts Medicare is to just ask your provider directly, ask their billing office. But if you want a list of providers that accepts Medicare, you can log on to CMS website, and there you will have a list of providers by zip code. So split family members when it comes to the PPO plans. So if you currently have one of these plans here, you want to follow it along to the right for your Medicare family members. So your non-Medicare family members will be in core, while your Medicare family members will be in UC Medicare PPO. So we don't kick your Medicare family members off the plan or your non-Medicare family members off the plan when someone is aging into Medicare. You're just considered a split family. Again, with the UC Health Savings Plan, you want to make sure that you look at all the other medical plans that UC offers and select a plan because Medicare is incompatible with this plan. If you're in one of these plans here, Core or UC Care, as you age into Medicare, this will be your new plan for you or your Medicare family members. So your deductible is $100. Your inpatient stay, days 1 through 60, is $0 copay. You pay nothing. Days 61 through 90, you pay $70.40 per day. Days 91 or more, you pay 20% of that stay. Your office visits, physician or behavioral health or chiropractic visit, you pay 20%. You could pay more than 20% if you choose a non-participating provider. So keep that in mind. You want to make sure that you select Medicare providers, and to pay the less amount out of pocket, make sure that you select an Anthem contracted provider as well. Your prescription drug coverage is listed here. There's no eyeglass benefit, so you may want to consider enrolling in VSP. Hearing aids is not covered by Medicare, but your supplement plan, Anthem Blue Cross, does cover it. They cover 80% of the hearing aid and you pay 20%. Acupuncture is also not covered by Medicare, but Anthem, your supplement plan, will cover 80% and you pay 20%. Your annual out-of-pocket maximum is listed here. So even though it may look like days 61 through 90, 70, 40 per day, or 20% of a stay may look like a lot that you have to pay, just keep in mind, our UC Medicare PPO plan has a maximum. You will never pay over your maximum in a year. So once you reach $1,500 out of pocket, your plan will then start paying at 100% for anything that's covered. Telehealth services, you still have that benefit. It's a $20 copay. This plan does offer worldwide coverage up to 6 months. But if you find that you're going to be vacationing or living abroad over 6 months, remember you have 2 non-Medicare PPO plans to select from, UC Care or Core. There are some services that I like to point out, and that's for your psychiatrists, psychologists, and your marriage and family therapists. Medicare does not cover these types of services, but your supplement plan does. Where I mentioned before that you must use a Medicare provider, these are the only services where you do not necessarily have to use a Medicare provider. And it's very important that you understand how your medical plan works, because a lot of times, and it happens with UCSD, a lot of our marriage and family therapists or psychiatrists, they don't accept Medicare. And this happens UC-wide. They just don't take Medicare. They've chosen to opt out. So it's important for you to know how your plan works so you can tell your provider that although you don't take Medicare and I'm in a Medicare plan, my supplement plan will cover your services. Most of the time, they're telling you that you have to pay cash up front. And I've had several retirees pay cash up front, not knowing that their supplement plan will pick up these services. So remember, it's ultimately your responsibility to know how your plan works. Again, the UC Health Savings Plan, it's not compatible with Medicare. It's not open to retirees for new enrollment. You have to already have been in this plan and carried it into retirement. We have some individuals that did not pay into Medicare and will never be eligible for Medicare beyond the age of 65. So you can remain in this plan if you already had it as an employee and carried into retirement. You'll still get your health savings account contribution every single year. And any balance over $1,000 can be invested. And after the age of 65, whatever money is in your health savings account turns into, you could say, real cash. Our other Medicare plan is the UC High option. This plan is only available during open enrollment. You cannot age into Medicare mid-year and select high option. So during open enrollment, if you and all family members are enrolled in Medicare, high option is an option for you at that time. And it has the lowest deductible of $50. Days 1 through 90 have no copay. Days 91 or more, you pay 20% per day. Your office visits are no copay. So you have a lot of retirees that will choose to enroll in the high option plan because most of the services are covered in full. Most, not all. But it is our plan that costs the most, so it has the highest premium. So you want to make sure that this plan is for you before you enroll. But it has no copay for office visits. For behavioral health, if you use a Medicare provider, you pay nothing. Prescription drugs or generics, you pay nothing. And then your generic, preferred, and specialty drugs, copays are listed here. There is no eyeglass coverage in this plan either. So if you're in this plan, you may want to consider enrolling in VSP. Hearing aids, again, not covered by Medicare, but Anthem will pay 80%, you pay 20%. Same for acupuncture. Anthem pays 80%, you pay 20%. Your out-of-pocket maximum is only $1,050. So after you reach your out-of-pocket maximum, your plan then covers at 100%. You still have telehealth services. It is worldwide coverage up to 6 months. And again, you do have coverage beyond Medicare for your psychiatrists, psychologists, and marriage and family therapists. When it comes to behavioral health services, depending on the plan that you're enrolled in, you or your family member will determine which behavioral health plan you have. One thing that I also like to mention is that as a retiree, when you're retired, you still have access to FSAP, Faculty Staff Assistance Program. It will continue. It's free confidential counseling and assessment. All you have to do is contact FSAP at this number or at this link. And FSAP for retirees is available no matter if you retired from campus or health, the medical center. FSAP is available to you. Now, I mentioned earlier about VIA benefits. If you are agent into Medicare and you're living outside of the state of California, but still within the United States, you would then enroll through VIA benefits. UC went this route years ago to offer the retiree and their family members more choices and more flexibility in selecting a plan in the state that they're currently living in. VIA Benefits is UC's Medicare Coordinated Program. What happens with UC is they will look at the number of years that you worked for the university. So someone who worked 20 or more years of service, you will receive $3,000 in your health reimbursement account, your HRA. Your family member that's enrolled in Medicare will also receive $3,000 in their health reimbursement account. Depending on the number of years will determine if that amount will be reduced. UC will provide this contribution for each covered family member, and you'll use this money to pay for your supplement plan and your prescription drug plan. Each family member is an individual. And in the state of California, if you're a retiree and you enroll in, say, high option, or let's see, that's not a good example, and you enroll in Kaiser Senior Advantage, all family members must be in Kaiser Senior Advantage. So you're the driver in the state of California for all family members. But under VIA benefits, each family member is individual, and you select your own supplement plan and your own prescription drug plan. So someone may have Anthem Blue Cross as their supplement plan, while your family member may be in Kaiser. So you can have two different plans. During open enrollment, the system is locked. You cannot access open enrollment because it's trying to make you go through the VIA benefits website and not accidentally enroll through UC's system. If you need to make changes to your dental or vision plan or add any family members to your plan, you must complete a paper form to make these changes.
Debra, just
yes.
a second. There's a question. There are actually several questions in the chat. I don't know if you want to address them right now or at the end.
Let's see.
There is one particular question about the previous slides. Is world coverage 6 months per year or per each travel?
Per each travel, yes. Mm-hmm. It's per each travel. So let me see, let me go back to the top. Maybe I'll just do the questions at the end because I'm just about done. And then we can go back over it. So opportunities to enroll or change plans is if you have a qualifying event. So if you are moving outside of your planned service area, or you have a newly eligible dependent, a new spouse, or you now have your grandchild that you have to care for living in your home, you get married, or you were covered under your working spouse and they're deciding to retire and they're losing coverage, those are all qualifying events for you to immediately enroll in your UC sponsored plan. But you want to make sure that you do it within 31 days during your period of initial eligibility. If you miss this opportunity, the only time you can make changes is during open enrollment. Now, if there's anyone attending today and you are working and you're planning to retire and you're beyond the age of 65, just make sure that you're aware you will be in the special enrollment period. So you will be required to submit a CMS L564 form, and you'll get this form from your retirement counselor. But if you're already retired, aging 65, you do not need this form. Just a little bit about our program. I'm a healthcare facilitator here at UCSD. I've been here 19 years, and we assist all employees, both health and the campus, all retirees. So we help a large population. So just know that our services are here. This program was developed to help you with escalated issues that you cannot address on your own. So before you contact us, just make sure you take the time to understand your benefits, call your medical plan, do your research, look at your evidence of coverage booklets online, log on to UCNet and review your premiums and medical plan comparisons, call the number on your bill. A lot of times I get a call and just, I got a bill, don't know what to do. Call the number on the bill, make sure that they billed your insurance properly. Contact your benefits office. But if you are still needing help and you have not been able to resolve it on your own, that's what we're here for. So feel free to contact our office. And then lastly, there is this tools and resources page. I've listed UCNet, where you can find your annual open enrollment information, evidence of coverage booklets, your retirement handbook. We have a link to the retiree medical plan cost and comparison link here. A quick reference guide, which Medicare plan is right for you, or Medicare and family members, and which medical plan is right for you for your non-Medicare family members. And then a few fact sheets. I've listed CMS, Social Security, and HICAP, the Retirement Association, Retirement Administration Service Center, RASC. If you don't know this number, you probably will eventually memorize this number. The Retirement Association, via benefits, your benefits office if you're a health employee, and the campus benefits office if you're a campus employee. And then I've listed my name here, a number, and my assistant here. And in conclusion, just to recap, when it's time and you're aging into Medicare, make sure you start the process 3 months before you or your dependent age 65. Reminder that Medicare premiums are deducted from your Social Security check. If you're going to delay collecting your Social Security income, make payment arrangements with Social Security. There's always a form that's required, no matter what, when you are aging into Medicare, that you must complete and return to RASC. Don't forget to look at your evidence of coverage booklets and your formularies just to make sure nothing is changing with your current coverage. Remember open enrollment, that's coming up fairly soon. At the end of this month, as a matter of fact, is your opportunity to add family members or make changes. If you need help, that's what we're here for. And that concludes the presentation.